Our pharmacists have played a phenomenal role in vaccine execution. They have been, right on the front line of delivering the immunization when someone looks back at them and says to them, I think you just saved my life. Early on during the pandemic, when people were so worried and so unaware and access appeared to be so limited, you needed a company like Walgreens that had 9,100 locations in the United States, where we were capable of delivering 20 million vaccines to medically underserved communities in the United States. That's pretty impressive. We were very deliberate about that. We said, we are going to bring it to you if you can't get to it yourself. We worked with the Black interfaith communities and developed clinic centers in churches, in communities where people are immobile. We worked with our partners at Uber, if you didn't have transportation, to get to one of our immunization sites. And so we actually went all in on vaccine equity because we knew that was a game changer because, I know we're 18 months into this and sometimes we forget, but if you recall, this was impacting the Black and Hispanic communities much greater in the beginning. And they were the most immune compromised. So we went after that because we knew our customers needed us the most. And so we've been very deliberate about that. We've delivered now over 30 million vaccines total and continue to do so right now as the plans are adjusting and we're going into third dose and boosters.
How has the pandemic changed the way WBA is dealing with employees in terms of flexible employment in different kind of hours? Yes. and meeting people where they are? And is that going to stay? For us, we're planning for it to stay. We've been doing work, studying the future of work, not really so much because of the pandemic. We would have done this anyway because the work environment is changing every day. And so for us, the real answer is flexibility. So I'm sitting now in the Chicago office, just north of Chicago in Deerfield, Illinois. And, our plans are to be flexible and have people come back to work based on when it's best for them and the way that they need to come back to work. So we'll have a flexible work arrangement. It's in our plans. Right now, we're working towards making sure that everyone is vaccinated before they come back into the office. And, we are a healthcare company and we believe in science and we believe in the data. And so with that respect, we're asking everybody to be vaccinated as well. I also spoke with Dr. Paul Elam, who is the Chief Strategy Officer at the Michigan Public Health Institute. MPHI is a nonprofit working to bridge the gap in health information and education.
We believe in trying to get upstream and understand where some of the underlying issues are that drive inequities, particularly public health inequities. And so we focus on the social determinants of health, right? Where people live, what policies might be contributing to lack of access to food, insecurities, homelessness, housing issues. And what we found early on in this particular pandemic, when you think about the epicenter of the communities that were impacted most, they were definitely in Southeast Michigan with the exception of prisons and jails. In a particular zip code area. And so we tried to go in and talk to youth in the Cody Rouge area, for example, to find out what some of the concerns that they have. And while we might be privileged to socially distance in our homes, some communities are not able to do that, right? They live in homes where they don't have separate bedrooms. They're not connected to Wi-Fi. And we've noticed that during the pandemic, violence has gone up, lack of access to education has gone up, social isolation has gone up in some of these communities that we're concerned with. And so I don't think there's a one-size-fits-all experience trying to manage our response to COVID-19.